Greetings and welcome to another lecture in Introductory Psychology. This one involves the somatoform disorders. Now, soma means body, and what these are health-related disorders. Now, the interesting thing about these health-related disorders is that, unlike most other psychological disorders, they appear to be purely psychological. These and the dissociative disorders pretty much are it. The rest of them appear to have, or at least may have, some sort of physiological component, but this doesn't. Now, the first disorder that I'm going to talk about is probably not going to be on a test, but it is something that I want you to know about. Hopefully, you'll listen to this before you watch the rest of them, or read the chapter in your book, or chapters. Because the first disorder is called medical student disease. And it's the tendency of medical students, as well as psychology students, to diagnose themselves with every single disorder that they are learning about. So you read about a disorder and you're like, oh my God, I have this, or oh my God, my friends have it, or my relatives have it. A couple of things I want to point out here. And the first is that you are in no way qualified, I suspect, to be able to make these sorts of diagnoses. I mean, I have a PhD in psychology, and I'm not qualified to make those diagnoses because my training is not in clinical psychology. It's in experimental psychology. I have the knowledge, but I don't have the ability to basically to diagnose these things, to be sure about my decisions in that realm. On the other hand, you probably know less about psychology than I do, so you have even less of a way to be able to. So first of all, do not be diagnosing people. And secondly, this may seem contradictory, but you also need to realize that psychological disorders are not all or nothing. It's not like you're completely and totally schizophrenic or else you're perfectly fine. There's a lot of area in between. And it's possible to be a little depressed or a little anxious or a little manic or even a little schizophrenic. And if you can still live your normal life and it doesn't bother you very much, then don't worry about it. So even if you have a little bit of some of these disorders, if it's not affecting your life in negative ways, then simply be aware and don't worry about it until and unless it starts to get worse. Now, there's kind of a subset of medical student disease, and this one I've also been guilty of. It's called Cyberchondria. It's the fact that these days, when someone thinks they may have a disease, they look it up on the internet, and they learn all the symptoms, and they learn everything, and oh my God, they have it, and they're doomed. Okay, sometimes a little knowledge is a dangerous thing. And sometimes it's better for you not to look up the possibilities, look up your symptoms to see what it is. Because like I said, maybe you are a little bit depressed, or maybe you are a little bit anxious. But if it's not affecting your life, don't worry about it. And reading about how it might affect your life can actually affect your life worse. So do keep both of those in mind. Unfortunately, cyberchondria is a lot more common. Back when I was young, you had to actually look things up in books. And that tended to slow people down. Other somatoform disorders include hypochondriasis. This is a person who is overly concerned with their health. And they have a tendency, whenever they have any sort of symptom whatsoever, to blow it up out of all proportion. They cannot accurately perceive what's going on with their body. So every headache is a brain tumor or a stroke. Every pimple is leprosy or melanoma or something like that. Every stomach ache is pancreatic cancer or whatnot. They blow things up out of all proportion. And when these people are reassured that there's nothing wrong with them, they don't believe it. So in hypochondriasis, people tend to take minor symptoms and blow them up into huge diseases that they don't happen to have. Now, a related disorder, all of these are more or less related here, is somatization disorder. In somatization disorder, people have real symptoms. They may have pain, for instance, and it's not usual pain. This is unusual pain. Or other symptoms that there's something wrong. And yet, when doctors diagnose them or examine them, they can't find anything physically wrong with them. They may report, for instance, great pain in their ankle, but when doctors go, there's nothing wrong with the ankle. It's not sprained, it's not broken, it looks perfectly fine, it looks perfectly healthy, but they're still feeling pain. Now, this is not faking. Okay? Neither is hypochondriasis, for that matter. They just blow it all up out of all proportion. Somatization is not faking. Faking is called malingering, and that's a whole different kettle of fish there. This is people are actually feeling these symptoms. And the idea is that their anxiety or stress, for instance, is manifesting itself as these symptoms, as this pain that they are feeling. So even though there's nothing physically wrong with them, there may be something psychologically going on, hence leading to this pain that they are feeling that has no physical cause. Lastly, we have conversion disorder, and this is like somatization but a lot larger. In conversion disorder, it's not just aches and pains that people are feeling, but instead it's something rather large. It's, for instance, could involve a loss of physical functioning. People are blind, people are paralyzed, people are deaf, people, a huge loss of physical functioning. Again, with no physical reason. There's nothing physiologically wrong with them. They are fine physiologically. There's nothing wrong with their eyes, but they can't see. There's nothing wrong with their ears, but they can't hear. Spinal cords working beautifully, but they can't feel. They're paralyzed. The idea here, again, is that psychological traumas are being somehow converted into this loss of functioning. And in a way, all three of these disorders, hypochondriasis, somatization, and conversion disorder, may indeed be related, like many of these other disorders, to stress in some way. Hypochondriasis, for instance. Perhaps what people are looking for with hypochondriasis is they're looking for reassurance. If you're really stressed out and everything's going wrong, it might be nice to have an expert listen to you and say, no, everything's okay. So it might be looking for reassurance, looking for attention in some ways. Somatization and conversion disorder might simply be a way for the body to take a sort of time out, and the mind for that matter. Because after all, if things are going horribly bad, that people are feeling aches and pains, or even worse, that people are paralyzed, no one is going to expect that person to go to work, or to go to school, or to do the things they normally do. You wake up one day and you're paralyzed, people are not going to expect you to live your normal life. They're going to expect you to try to get better, which would usually involve reducing the amount of stress in your life. You don't have to worry about work anymore, now you're paralyzed. You don't have to worry about school anymore, now you're blind. Or with somatization, the aches and pains and everything else, well, maybe you have a really bad headache from that, so you stay home and there's less stress and that. So that may be ways of sort of taking a little time out. And indeed, what work has been done with somatization and conversion disorder, both of which appear to be quite rare, particularly conversion disorder, it's almost as if the people who feel this way, particularly with conversion disorder, as I said, aren't really worried that all of a sudden they're blind or deaf or paralyzed. They're just like, oh, well, I can't see. That's horrible. I think I'll just lay here for a while until somebody else gets up or something. And that may be a reflection of the fact that their mind is taking a break by causing their body to break, essentially. So as I mentioned, these are all very interesting disorders. They all appear to be purely psychological. And I particularly suggest that you stay away from medical student disease and cyberchondria. As much as you might want to look everything up and how fast it is and easy it is when you have a phone and you could Google things just instantly, when it comes to disorders, you might not want to.